Hi, and welcome to Module 2, Access Interpretation. Let's get started. A little bit of a review from last time. Just wanted to go over the anatomical regions again. Kind of jump in here. We've got lead 1, AVL, V5, and V6. These are our lateral leads represented here, and we're looking at that lateral side of the heart. If we look at lead 2, lead 3, and AVF, these are our inferior leads, and we're going to look at this inferior portion of the heart. If we look at V2, V3, V4, these are anterior or septal, and sometimes V1 can also be categorized in there, but they're going to look at the anterior portion of the heart. And then AVR and V1 are more so are right-sided, and they're going to look at the right side of the heart, right? And to piece together just a little bit more here, for the inferior leads, they're typically supplied by the RCA 90% of the time, or the LCA. For the lateral leads, supplied by the LCA for lead 1 and AVL, and then either the distal LAD, the LCA, or the RCA, depending, for V5 and V6. And then for the anterior and septal leads, that's going to be our LAD for V1 through V4. Let's talk about Axis now. The goal here is to teach you not only the importance of the QRS Axis, but then how to approach it. And we're going to go over two different methods for this. We're going to start with our isoelectric lead method using a clock face, which I'll teach you how to do. And then we're going to talk about a little bit simpler of a method, kind of using some of that reasoning that we talk about first, but we're going to talk about the quadrant method. And hopefully that's something that you can use on your exams and help you ace your tests. So the QRS axis is the average direction of electrical activity through the heart's ventricles during depolarization. What does that mean though, right? It means if we take the average electrical conduction system that we expect, right, it's going to go from that upper right side in the SA node down towards the apex of the heart and then around. So even though the signal is going all over the cells so that we can have a contraction, remember we have a depolarization wave. So it's a force that is going a specific direction to create this uniform contraction that happens. The QRS axis is what we call that bulk of the flow. It is where most of the direction of that electrical activity, where that current is going. And we are able to give that a numerical value in a degree, and that helps us understand more about what's going on inside of the heart. So let's learn how to draw our clock face. If we take lead 1 here, and this is hopefully a reminder from the first lecture as well, lead 1 is positive on the left arm, and it is negative on the right arm. So we're going to go ahead and transpose this here. We're going to take this line and we're going to pick it up and we're going to put it over here. And we're going to say lead 1 is positive on the left side and negative on the right side. And then we're going to do the same thing for AVF. Drawing our line here, let's transpose. This is going to be AVF. And we know it's positive on that lower side towards the foot, AVF for foot, and it's negative on the top. Now we're going to do that same thing for lead 2, and what we're going to do is, again, match this angle, and we're going to pick it up, and we're going to draw it over here. So lead 2, we would expect to look something like this. Obviously, there's some artistic freedom here. Not everything is going to be perfect, but you got to bear with me on this. So lead 2, matching to the best of our ability, the direction, positive on the bottom, negative on the top. We can approach the same thing with lead 3 and draw it in something like this. Positive down here and negative up there. And then we can do the same thing with AVL. AVL is positive on that left-hand side. So we'll draw that in here. It's the same angle the whole time. Positive up on the left arm, negative on the other side. And then our last one, AVR, is positive up at the right arm and negative on the other side. And what I mean, remember with these positive and negatives, these are the positive and negative electrodes that make up the lead. Our lead 1 is positive on the left side. Lead 2 is positive at the foot. Lead 3 is positive at the left leg, the foot. AVF, positive left leg or the foot. AVL, L, left arm. AVR, R, right arm. So we can think of these also as vectors. And we could even draw in little arrows that tell us what direction these leads are going. Because that's really what they're doing. That's what they're showing us. They're all going towards these positive electrodes. Now, anything that happens, actually, let's assign some numbers to these first, okay? So we're going to see lead 1 here is going to be 0 degrees, just like a graph, just a normal graph. Now we're going to go down, and we're going to say this is positive 30, positive 60, positive 90, positive 120, positive 150, and positive 180. And the same thing going up, we got negative 30, negative 60, negative 90, negative 120, negative 150, and then lead 1 is positive or negative 180. Alrighty, so we know, just like your average graph, positive is going to go to the left. The only difference here is we're flipping it upside down. We're going to say the positive side is going down towards the floor as well. If we were to say normal versus not normal, normal is going to be anything in this region. Anything in here is a normal axis, and we'll talk about why in a second. Anything from that negative 30 to that negative 90, this is going to be a left axis deviation. Anything from negative or positive 90 to positive or negative 180, well, this is going to be a right axis deviation. And anything from that positive or negative 180 to the negative 90, well, this is going to be our extreme axis deviation. All right, so let's put this to a picture that hopefully you understand as well, and that's the heart. If we think about the flow of electrical current from the heart, like I said, we go from this right corner and we go down through the ventricles and out, right? The bulk of the flow should be going down towards the apex. That is how we are designed. And so it makes sense that normal would be anything from this positive 90 to this negative 30. This is all that bulk of the left ventricle. If our flow is going to the bulk of the left ventricle, that's what we physiologically would expect, right? The left ventricle tends to be larger than the right side in a healthy population. It has to pump to a larger area. We know that it's a bulkier side. This all makes sense. If our flow is going further to the right side in the right ventricle, well, we probably should investigate that a little bit. If we're going a little too far to the left, well, we also should investigate why and see what's happening over there. And if we're going the completely opposite direction, well, absolutely, that's something that we have to look at. Now, the QRS axis, we can find that by going 90 degrees from the isoelectric lead, which is going to point in the direction then of the positive lead like we talked about. So remember, if we are going towards a positive electrode, we should get a positive deflection. If we are going away from a positive electrode, we should get a negative deflection. But if we're going perpendicular to a positive electrode, that's when we get our isoelectric line. So by finding this isoelectric line, if we're trying to take the summation of all of these different vectors that are happening, at all of these different currents, and we're trying to take the average, where is the bulk of it going? If we find whatever is the most isoelectric, reasoning would stand, whatever is perpendicular to that would be the lead that has the greatest amount of current, the greatest energy, the greatest force, the largest vector. So let's try an example and put it to practice, okay? Remember, we only look at these 6 leads here. 1, 2, 3, AVR, AVL, and AVF. And that's because these are our limb leads. And this is what we use our clock face for. These are the ones that are in the coronal plane that allow us to put the heart on a clock. And I think it's pretty easy to tell with this one the most isoelectric line here is going to be AVL. It's the line that is the flattest. It is the most close to zero. And we can calculate that out by saying, okay, well, it goes a couple boxes up and maybe one box down. But if you were to subtract the two, we've got maybe a 2-box difference between going up and going down. Versus lead 2 over here, we can see that this is clearly more positive than it is negative. Lead 1 is clearly more positive than negative. 3, same thing with AVF. AVR is clearly more negative than it is positive. So the most isoelectric line, the flattest, the closest to zero, is AVL. So if we plot AVL on our diagram here, and we say this is our isoelectric line, and we want to go 90 degrees from AVL to get our QRS axis, that's going to be lead 2 here. Remember, lead 2 goes down towards this positive 60 degrees. That's our QRS axis in this example, right? We found most isoelectric line. We plotted it here, 90 degrees, positive 60 is our magic number for the QRS axis in this example. This is just another diagram to show you with the different versions of normal. Normal is anywhere from positive 90 to negative 30. We've got our left axis deviation kind of going from negative 30 to negative 90. Right axis deviation from positive 90 to 180. And extreme axis deviation is that upper left quadrant there. All right, let's break it down a little bit simpler for you. The quadrant method. We're only going to look at 2 leads for this. We're going to look at lead 1 and AVF. And all you have to do is decide if lead 1 and AVF are positive or negative. Remember, positive means it goes further up than it goes down. We have a greater R than S. Equiphasic means they're equal. If it is equiphasic, this is not going to be a good method to use because you won't know if it's positive or negative, and you can't apply it to the quadrant method then. You're going to want to go back to your isoelectric line method. If it's more negative, the S is going to be bigger than the R. The deflection goes down. So pulling the principle of what we saw from clock face earlier, we know that lead 1 is that horizontal line, and AVF is like our y-axis. So x and y-axis, this is all it is. AVF, positive is down here. Okay, so if we take this example over here and we say, look at that, lead 1 is positive. I'm going to go ahead and shade in the positive side of lead 1. If AVF here is also positive, we can go ahead and shade in the positive side of AVF. Now where these two intersect, well, this must be where the QRS axis is. That's the quadrant method. It doesn't give you a precise, this is positive 60 degrees, this is negative 30 degrees, but it gives you a range. Somewhere within 0 to positive 90 degrees is our QRS axis in this example. All right, now for your test, you can also use it you can figure it out using your thumbs. So lead 1 is going to be your left hand, and AVF is going to be your right hand. Now, if both are positive, you've got positive, positive, that's 2 thumbs up. That's a good thing, normal axis. Now, if lead 1 is positive, so your left hand is thumbs up, and lead AVF is negative, thumbs down, well, your left thumb is up, so it must be left axis deviation. Now, if lead 1 is negative and lead AVF is positive, you got a right thumb up, that's right axis deviation. And if both thumbs are down, because they're both negative, well, that's a bad sign. It's pretty extreme. It must be going in the wrong direction, 2 thumbs down, extreme axis deviation. The only point here to kind of remember is when we say it's possible LAD, the reason behind that is we know that this quadrant here represents both a degree of normalcy as well as a left axis deviation. And so if your test asks you for a specific, you might want to clarify it using the isoelectric method or another method. And that's really all we have for this lesson here. We'll go in on the next one to go a little bit more on how to read and analyze a full 12-lead EKG. But I think the QRS axis is so important, and it's often one of the more confusing topics. So definitely Watch this as many times as you need it, practice it, get comfortable with it, and then I'll see you in the next lesson.